So blurring of vision may be due to a variety of reasons, some of which may be due to age-related problems, may be associated with systemic conditions, or maybe congenital. The severity of the blurring of vision would depend on the stage and nature of the disease. So the most common age-related eye problems we see in the clinics are cataracts, age-related macular degeneration, and glaucoma. However, with advancing age, there are also increased number of systemic conditions present in the patient, such as diabetes, hypertension, which may lead to eye problems. So, the number one cause of reversible blindness worldwide is cataract. So, since cataract is age-related, the older you get, the higher the chances of having cataract, which may be visually significant. However, these cataracts are generally reversible, so there are certain procedures that may be done in order to preserve the vision of the patient. For the more concerning conditions such as age-related macular degeneration, or glaucoma, or diabetic retinopathy, these conditions deserve a more close monitoring, thereby requiring patients for monitoring of disease progression. So, for example, for patients with age-related macular degeneration, these patients have the potential to develop severe vision loss. So, usually we see age-related macular degenerations in patients age 50 and above, and those who are at risk are usually patients who are smokers or with cardiovascular diseases, with hypercholesterolemia, and some other non-modifiable risk factors. So for patients with glaucoma, which is also an age-related disease, you should also be in the age range of 50 and above. The problem with glaucoma is it is usually a silent disease, meaning for the time the patients would recognize that there's something wrong with their vision, it's already in the late stage of the disease. So we urge our patients to have eye screening done so as to prevent progression of the disease to a late stage. This is the same with diabetic retinopathy. So for patients with diabetes, usually the diabetic retinopathy would not have symptoms unless it is already in the late stage. And for diabetic patients, the most important factor there is the control of the diabetes. Also, the longer the patient has diabetes, the higher the chance of having diabetic retinopathy. So, we also advise our patients to have yearly follow-up for patients with retinopathy to monitor progression, and also for other. So usually, if there's diabetic retinopathy, we also check for diabetic nephropathy to see if there are other organ systems involved. As I've mentioned earlier, there are a few lifestyle changes that we advise patients in order to decrease the risk of disease progression. So let's say for age-related macular degeneration, it has been seen that smoking, hypercholesterolemia, and cardiovascular disease may increase the risk of developing AMD. So if we push for smoking cessation or control the cholesterol levels, there may be decrease in the risk of developing vision loss due to AMD. So for diabetic retinopathy, diabetes control is the number one most important risk factor for developing diabetic retinopathy. Okay? However, for cataract, since this is age-related, there is really no known way in order to decrease the progression or stop the progression of cataract, development of cataracts. The same is true with glaucoma. With glaucoma, there's really no way of preventing having the disease, only controlling it. So what's important with glaucoma is early intervention so as not to develop advanced glaucoma. So as ophthalmologists, we see optometrists as partners in health, in eye care. However, an optometry checkup is not a substitute for a complete ophthalmologic exam. Optometrists may be helpful in providing refraction or for screening certain diseases. However, a complete ophthalmologic exam is essential in order to screen for cases of, let's say, glaucoma, diabetic retinopathy, AMD, etc. So like with any other diseases, eye problems may be age-related. So usually we advise patients, whether or not they have a pre-existing systemic condition, to have a regular follow-up. So depending on the patient's disease, this may be yearly or as early as a month, or maybe weekly. However, what is important here is that they see an eye specialist to get a baseline of the status of their eyes. Some diseases, these may be asymptomatic, which means patients will not be complaining of anything, only to find out that they already have an advanced disease once they see an ophthalmologist. So this is to err on the side of caution. Okay, so we advise patients at least see their ophthalmologist once a year, just to have an eye screening done. I'm Dr. Cyrille Cabrera, ophthalmologist, your partner in health.